Well, hi friends, I want to show how a fallen arch can affect the knee, the hip, and the low back. The spine has joints, left side and right side, and these joints are made for forwards and backward movement, to just bend forward and backward. They're not meant to rotate, so any kind of rotation is irritating to the joints and the surrounding muscles and the disc between the vertebrae. So what we look for is, are the hips themselves level? Then we're also looking at the pelvis, is that level, and is the spine straight up and down? That's what we want. If for any reason that spine is going to fall because of the leg length on that right side, it's going to put strain on those joints. Now they're stretched, they're going to rotate, and it's an irritation. They can lock, things can tear. It puts added weight on that hip. When the arch is in its perfect position, the leg is straight. With that arch dropped, it puts tremendous pressure on that knee and it rotates. Let's get started. This is a very precise 16 lasers measurement for positioning of 3 arch supports for each orthotic. So the device has 3 layers of measurement. There's a photograph of the foot so we can visually see pressure points. There is a black and white that the laboratory is going to use for their shading purposes for the arch placements. And now we're going to show you a pressure visual as well. What they're trying to demonstrate here is when that arch falls, it affects the entire spine. More pressure on the right side than on the left. And then this will be sent to the lab, and they will know exactly where to put the arch supports for protection. So if the arch falls, it's going to have that knee rotate in, which is going to strain the hip, strain the back, and go all the way up into the shoulders. So this is really, really important. Our goal is mobility. We want you to have the mobility to do what you want to do and the energy to do it. So this is the orthotic. Here's the primary arch. This is going to support the ankle, the arch, to take the pressure off the knee, the hip, the back. Then there is the ball of the foot. Now this is extremely important. It takes weight off of what's called the metatarsals, the big knuckles of your feet, and what we don't want is this to build up scar tissue, and that's the bunion. So we're trying to protect that knuckle, and that's what this is for, and that precise positioning is done with the lasers. Then there's an outer arch, and this is for stability, balance, protection. It's very important. Now they make different ones for different applications. This has the most compression for very active heavy-duty use. This foam is very specific for spring back, so it not only gives compression but actual spring back for fatigue. It's a temperature controlling fabric, and it's extremely durable. Very, very good shock absorption in the heel. This one is called the InMotion. It's a little thinner in the toe box. This is going to be for a wide open lace shoe and for boots. This one is more for walking. This is a fabric that absorbs moisture and releases it, dries very rapidly. This is the same fabric, different color. This is for standing on your feet all day. It's got very dense foam. It's to give protection on concrete floors. Excellent heel. This is for an industrial. It's made for high moisture areas. It's got the shock absorption in the heel, but it can get wet. We've got orthotics for 3/4 length. So if you have a tight toe box, we can still get our protection. We still have the orthotic protection, but it's not going to crowd the toes. We have it for 1-inch heels and 2-inch heels. And for pregnancy, as the with the baby's development, the positioning, the weight positioning of the mother changes. So we've got the second trimester, the third trimester, and then after the baby's delivered. We also, coming in with spring, how about that? Sandals with orthotics built in them. All 3 arches and in the sandals. You can't beat that. And they also have a shoe orthotic where the orthotic comes with the shoe, just in one whole package. So your mobility matters. Next time you're in your office, we'll give you a scan. Thanks for watching.